Allied health professionals, community health. The health of the community depends on a large number of people, other than medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They include the following: physiotherapists, physios, help people to move by getting them to do exercises or by treating their body with heat or massage, treatment by manipulating muscles and joints with the hands, occupational therapists, OTs, help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally, for example, blindness or deafness. Social workers help people to solve their social problems, for example, poor housing or unemployment or family problems. Chiropractors, also known as podiatrists, treat conditions affecting the feet. Technicians, there are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians, ambulance technicians, work in the emergency medicine service. An ambulance technician with more advanced qualification is called a paramedic. Prosthetists and orthotists. Prosthetists and orthotists provide care for anyone who needs an artificial limb, a prosthesis, or a device to support control a part of the body. And orthosis, they also advise on rehabilitation, helping patients return to normal life and work after treatment. Prosthetics provide artificial replacement for patients who have had an amputation or were born without a limb. Orthotics provide a range of splints and other devices to aid movement, correct deformity from an abnormal development of part of the body, for example, club foot, talibs, and relief pain. Opticians test eyesight and prescribe glasses, also known as spectacles, and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of a fluid inside the eye, and examining the retina. If the optician suspects an eye disease such as glaucoma, they refer the patient to the GP for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in diseases of the eye. Profesionales aliados de la salud, comunidad de la salud. La salud de la comunidad depende de un número grande de personas, como médicos, practicantes y enfermeros. Estos pueden ser agrupados bajo el encabezado de profesionales aliados de la salud. Estos incluyen los siguientes: fisioterapeutas, fisios, ayudan a las personas, su movimiento por ejercicios o tratando su cuerpo con calor o masaje. O más tratamientos de masaje manipulando los músculos y las articulaciones con las manos. Terapistas ocupacionales ayudan a las personas con disabilidades para agendar tareas en casa y en el trabajo. Una disabilidad es una condición mental o física que dificulta vivir normalmente. Por ejemplo, ceguera o problemas de audición. Trabajadores sociales ayudan a las personas a resolver sus problemas sociales como casa pobre, desempleo o problemas familiares. Quiropodistas, también conocido como podiatra, tratan condiciones que afectan a los pies. Técnicos. Hay muchos técnicos, numerosos técnicos, personas que trabajan con equipos científicos como radiógrafos, que también son conocidos como técnicos de rayos X. Técnicos de ambulancia trabajan en el servicio de emergencia. Un técnico de ambulancia con más calificaciones avanzadas es llamado paramédico. Prótesis y ortosistas. Prótesis y ortosistas proveen cuidado para cualquier que necesite una prótesis o un dispositivo de soporte o controlar el parte del cuerpo. Una ortosis también recomienda la rehabilitación, ayudando a pacientes a regresar a su normal estilo de vida y trabajo después de tratamiento. Los protesistas proveen reemplazos artificiales para pacientes que han tenido amputación o nacieron sin alguna extremidad. Ortosistas proveen un rango de tobilleras y otros dispositivos para apuntar al movimiento correcto. La deformidad de un desarrollo anormal del cuerpo, por ejemplo, un mal desarrollo del pie. Utilizan soportes de los pies para ayudar al dolor. Los ópticos me hacen pruebas para las miradas y prescriben lentes, también conocidos como espectáculos o lentes de contacto cuando son necesarios. La examinación incluye medir la presión intraocular, la presión del fluido dentro del ojo y examinar la retina. Si el óptico sospecha que hay una enfermedad del ojo como glaucoma, refieren al paciente al doctor general para tratamiento. El doctor general lo puede referir al paciente a un oftalmólogo, un doctor que es especialista en las enfermedades del ojo. Make word combinations using word from each box. Look A, B, and C and D opposite to help you. Ambulance, technician, artificial limb, club foot, contact lens, health professional, intraocular pressure, occupational therapist, social worker. Which allied health professional could be best help the following people? Look at A, B, and C and D opposite to help you. a young unmarried woman who has just had a baby, social worker, and a woman who has having difficulty using her right arm following a fracture, physiotherapist, someone who needs glasses, opticians, an elderly woman who has had a below knee amputation, occupational therapist, a man with a fungal infection, and feet chiropodist. Complete the text, look at A and C opposite to help you. A prosthetics work with patients of all ages as a member of a clinical team based at a large hospital. The patients may need a prosthesis as the result of an accident or artificial limb following a disease such as diabetes. Alternatively, they may have been born with a limb. Orthotists who work alongside the doctor, nurses, physiotherapists, and occupational therapists to give people under their care the best possible life. Their meaning is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformity. If damaged, any part of the body skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. Hospitals. Introduction to hospital. Jordi Pons is a fourth-year medical student from Barcelona who has come to Britain or an elective attachment to the Royal Infirmary Edinburgh. Dr. Baron is introducing him to the hospital. Dr. Baron, the Royal Infirmary is the name of the University Hospital for Edinburgh University. It is a general hospital dealing with all types of patients' illnesses except pediatrics. We have a specialty hospital for that in another part of Edinburgh. The hospital for sick children. You can see some of the departments in our hospital on the sign. Of course, there are many others. For example, the intensive care unit (ICU) and the surgical high dependency unit (HDU). Jordi, what does outpatient means? Dr. Barrow, outpatients are the people who come to the hospital to attend a clinic or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for one or more days. The rooms where they stay, they call wards. If a patient's treatment requires only 1 day, such as simple operation, they can be admitted to the day surgery unit. Outpatients. Dr. Barron, the accident emergency department A&E, also called casualties, where the patients who are acutely ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see specialists go to a clinic in one of the outpatient department OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. Inpatients. Dr. Barron, these patients in a hospital are admitted in one of three main ways. They may be seen in one of the patient clinics and admitted for one thereof if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, with a suspected myocardial infarction, or they are seen in the A&E department where the doctor on duty working on that time arranges the admission. This will happen in the case of a patient with a fractured neck or femur. For example, larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. You're the assessed? Yeah. Yes, decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care. Hospitales, introducción en un hospital. El Jordi Ponce es un estudiante de cuarto año de Barcelona, ha venido a Bretaña con un electivo para la Enfermería Real de Edimburgo. El Dr. Barrow le está introduciendo al hospital del Dr. Barrow. La Enfermería Real es el nombre del hospital universitario para la Universidad de Edimburgo, que es un hospital general tratando con todo tipo de pacientes y enfermedades, excepto pediatrías. Tenemos un hospital especializado para eso en otra parte de Edimburgo. El hospital de niños para niños enfermos. Puede ver algunos departamentos en nuestro hospital. Sí, hay muchos otros, por ejemplo, la unidad de cuidados intensivos y la unidad de alta dependencia quirúrgica. ¿Qué significa paciente de fuera? Pacientes, Dr. Barron. Pacientes de fuera son las personas que vienen al hospital para la clínica o tienen de otra clínica para tener exámenes o tratamientos y luego regresan a casa el mismo día. Los pacientes de dentro se quedan en el hospital por uno o más días. Las habitaciones donde se quedan son llamados cuartos. Si el tratamiento del paciente solo requiere un día, como una operación simple, pueden ser admitidos a la unidad de quirúrgica del mismo día. Pacientes de fuera. Doctor Baron, al departamento de accidentes y emergencias, ahí también llamado casualty, es donde los pacientes que están muy enfermos, de repente con una seria condición, vienen para asignaciones y tratamientos. Los pacientes de afuera que tienen una cita para ver un especialista van a una clínica llamada departamentos de pacientes de fuera, OPD. También ellos usualmente han sido referidos para el hospital por su doctor primario, que hace una orden al consultante explicándole el problema del paciente. Pacientes de adentro. Doctor Baron, los pacientes de adentro son admitidos en una de estas tres principales formas. Quizás puedan ser vistos en la clínica de pacientes de afuera y se admiten desde ahí, o hay muchas demandas para el tratamiento que necesitan, como el caso de un reemplazamiento de cadera, son puestos en una lista de espera para admisión. Complete the table with words A, B, and C opposite. Put the stress mark in front of the stress syllable in each word. The first one has been done for you. Verb and noun. Admit, admission, assess, assessment, discharge, operate, operation, refer, treatment. Make word combinations using a word from each box. Look at the opposite to help you. Acutely ill, assessment unit, on duty, referral letter, waiting list. Which hospital departments will be most appropriate for the following patients? Look at A, B, and C at opposite to help you. A woman in diabetic coma, intensive care, a patient who has just had radical prostatectomy, high dependency unit, a patient who is to have a skin lesion removed, day surgery, a man with foreign body in his eyes, emergency room, and a woman with renal abortion, gynecological emergency. Complete the slide for information, left for patients, look A, B, and C outside to help you. When you arrive to reception, please tell the receptionist who welcome you. Check the details and direction to the waiting area. The length of the visit will depend on the treatment. You may need to have some tests such as X-rays. We could be going to another clinic.